evening, listeners and viewers. It's 6:42 and it's time for the nation's business. I'm Chevon Campbell.
And my name is Sanjay Lewis. And Chevon, the Health and Wellness Minister, Dr. Christopher Tufton, has pointed to data from a study done by the Caribbean Policy Research Institute, that's CAPRI, which shows that 20% of Jamaican children have a mental health disorder. The issues range from anxiety to attention deficit hyperactivity disorder, post traumatic stress disorder, and conduct disorder. The minister says 35% of Jamaicans with mental health disorders reported onset of the issue before the age of 14.
63% reported onset before the age of 25. Speaking Thursday at the formal opening of the Child Adolescent Wellness Centre in St. James, Minister Tufton says the first study he commissioned after being appointed minister in 2016 was a mental health and wholeness passport report that led to a series of policy changes regarding how to address mental health in the population. Among them was the goal of creating a more community-based approach to interventions such as the Child and Adolescent Wellness Centre.
I say all of that to just place why we are here in context. This is absolutely a necessity, and the people who are going to benefit from this, I am sure will be extremely appreciated. The persons and institutions who are contributing to this, I want to salute and say a big thank you for that. And from a health perspective, Ministry of Health and Wellness, this for us is an essential partnership as we seek to build societies starting one community at a time.
And that's Dr. Christopher Tufton, the Minister of Health and Wellness. The center, located at 1 Humber Avenue in the Second City, opened its doors to clients on November 12. To date, close to 30 clients have been seen by a team consisting of 1 mental health nurse, 2 psychiatric nurse practitioners, a social worker, and along with an admin assistant and a clinical attendant. Head of the center, mental health psychiatric nurse practitioner, that's Takia Brown, said the center is currently being promoted in schools and the workplace.
She says parents are becoming more comfortable seeking help for their children despite the stigma. And joining us to discuss further are the Mayor of Montego Bay, that's Richard Vernon, and Senior Clinical Psychologist at the Western Regional Health Authority, Georgia Rose. Good afternoon, Sir Vernon and Madam Rose.
Good afternoon. Good afternoon, Madam Rose, and to your listeners.
So, ladies before gentlemen, Georgia Rose, how has the work thus far of the Adolescent Centre, the Children and Adolescent Centre, impacted the mental health and wellness of our youth down there in Montego Bay?
Thank you for that question. So the first thing I want to advise is that child and adolescent mental health services have been offered in the region for over 30 years. So the service offering is not new. What the center represents, however, is a targeted space that is intentionally there to provide these services in a more holistic manner. So we have been providing the services for years. We now have a space that centers around that. We no longer have to share this space with any other service. And that then gives the privilege to really create an environment that we believe speaks to and promotes mental health and wellness.
And Mayor Vernon, what role does the municipal corporation play in supporting mental health programs like these?
Well, we identify cases through the Poor Relief Department, and we usually work with KUMI and all the necessary entities that enable us to address the mental health situation that we have within the parish. So we have a list of persons who are also on our roll of 4, and they are seen by the entities from time to time. But this particular focus approach is very welcome. It's a big deal for the city of Montego Bay and for Western Jamaica because it particularly targets youngsters. And some of the times when we see the early signs of mental health challenges, we have to nip it in the bud, and that is why the center is important for a city, because it aligns with our strategic direction in terms of achieving sustainability here.
Georgia Rose, these type of mental disorders, usually they are most or first detected in schools. Do you work closely with the schools in terms of identifying individuals who might be showing signs of behavioral disorders?
Yes, we do. So you are quite accurate when you say a lot of our referrals do come through the school systems, and the Ministry of Education is one of our most valuable partners when you think about our child and adolescent mental health services across the island. I want to commend the Ministry of Education because in the last few years, they have also been very invested in...
Ms. Rose, are you there? Oh dear, it looks like we lost Ms. Rose. We'll come back to her shortly.
Mm-hmm. So let me jump to Mayor Vernon then, because talk to us about how the city is engaging residents to bring awareness about mental health issues, particularly among children and adolescents.
Well, we work through the St. James Health Services, and the St. James Health Services is so designed to carry out the sensitization in schools and whichever forum that is available for them to execute the sensitization campaign. So that is how we primarily work to spread the word of mental health. But we have also engaged the Autism Center, the Montego Bay Autism Center, because that's another component of the project that we will be looking at in the future. And we are keen on providing some type of support to the Autism Center so that it can expand and take care of much more of the cases that we have within the city. For some reason, we realize that these cases are popping up more frequently, and I guess that some research would guide us as to how or why this is happening. But until then, we will continue to play our part in helping the center where possible, and work closer with the Ministry of Health through the St. James Health Services to address these cases.
And Richard Vernon, tell me exactly, I know it said about 30 people so far have been assisted by the center. Is there any intention to expand the services of the center?
Well, there were, ideas touted pertaining to expansion, but not immediately. And as you would know, the center is based on the Citizen Security Program, which brings together all the different agencies within the Ministry of National Security, Health and Wellness, and Education. And having that focused approach to address the situations pertaining to mental health, the clinical ones in particular. But there are also other services that the center offers, such as engagement of the patients and the clients that utilize the area. We also are keen on the support that is given by the information center that is just next door. And sometimes they will also get referrals from the information center, because that is where they go for homework, the students after school. And we, for the city of Montego Bay, why this is a massive project, it is because when we look at our statistics, it is telling us that 70 to 80% of homicides, for example, are related to gangs. And another 70 to 80% of the homicides committed by gangs are associated with guns. But what we need to get to, while we try to get the guns through our Get the Guns campaign and other methods of policing to reduce the inflow of guns and the distribution of guns within the country, we have to get to the point of addressing what causes a person to pull the trigger, which is psychosocial intervention. And that is why it is important to us. So while we talk about the statistics, getting murders below a certain number, a certain target, each year we set a target and we try to work towards it. These are some of the initiatives that we must have to ensure that we can meet these targets. It's not just about policing. Psychosocial intervention is important. At early signs, is important to abate such behavior in the future. So once they can identify these students in the school, oh, that boy is not just a bad boy. He may have strain dealing with at home, domestic abuse, intergenerational strain, moving from one family to the next, and this child is just a victim of strain in the home. And you need to look at the situation individually, address the situation from that point, because if you do not, later on that child, male or female, may very well try to associate or identify, and by trying to push towards that may end up in a gang that will also be associated with the numbers that we are speaking to. So this is important for us, and the expansion of it is even more important because it means now that we can address the many cases that we have. I think some point in time the number was given that we have about approximately 22,000 cases in Western Jamaica to attend to. So this is a drop in the bucket, but a very good start, a strong start to something greater.
You touched a little bit on where I was going to head next, which is the plans to expand this kind of service to other areas of Montego Bay. Is there a timeline in place where we will see a rollout of more of these centers across not just Montego Bay itself, but the rural communities within St. James?
Speaking of a timeline, I couldn't give you that. That is primarily from the Ministry of Health and Wellness, particularly because we would have to use the primary healthcare unit in the near future or immediately to execute the program. And that will have to be curated by the ministry. So I couldn't speak to it directly, but I know that there are plans afoot to expand the intervention across communities. And primary health care is important because we get to go to the communities and provide access to the remote residents who may or may not be able to go to the town center at our type 5 clinic. So we have to reach out to them in the communities and ensure that they get tip-top attention where healthcare is concerned. And healthcare is not just about the medical, it's about the mental health situation that we have to deal with. And you have heard the numbers pertaining to how many of our residents across Jamaica that are affected by mental health challenges and how many of them actually need psychological attention. So it is a big situation, and I don't think enough of our people take mental health serious. And that is one of the reasons we perhaps may have not been aggressive in terms of rolling out programs and initiatives like these in the past.
Ms. Rose, I understand you're back with us.
I'm back. Yes.
Welcome back.
Please assist me. Let's say a child has been identified in a school as being disruptive because of a behavioral challenge.
Right.
What is the process now to get that child assistance when they're brought to the center? I'm sorry, Ms. Rose?
Are you
your line is very
Nice
spotty
bad.
there, unfortunately.
No,
We're
not hearing
going to
her
try to
call.
reach you again, Ms. Rose. Your line is very spotty. But let me go back to you then for a second, Richard Vernon. This matter of the establishment of the Child and Adolescent Wellness Centre in St. James, what is the process of, say, a mother or a parent who says that they have some issues with their child and they'd like to get in contact with the center? Do you have any information that you can provide to our listeners as to how they go about doing that? Ms. Rose, are you there?
Yes, I am. Are you hearing me?
Yes, quite
Wonderful.
clearly.
Yes.
Yes. It depends on the symptoms that are being exhibited by the child. If the guidance counselor, who is primarily the referral point, believes that this is outside their scope of capabilities, because our guidance counselors are trained and do an excellent and competent job, they oftentimes will call us because they do have an intimate relationship with us where they can discuss the children or the clients, whatever way we want to label it. They are then sent to the center where we do a screening or an intake to ensure that we are the right point of contact. Because we also want to educate and advise that there can be organic and medical conditions that contribute to behavioral changes and problems or challenges in the management of behaviors. So we need to ensure that this is a psychological or a mental health issue before we proceed. Once it is determined that we are the right and appropriate space to provide the best intervention for the child, we then engage in a treatment plan that incorporates the family and the school as much as possible. And this is a multidisciplinary approach. We have our psychiatrists or social workers, our mental health nurses, and our psychologists. Our children might also need external referrals to speech and language pathologists and therapists, and also occupational therapists. So it is a multifaceted, multidisciplinary approach to ensure that we really are meeting the needs of our children.
Understood. Go ahead, Sanjay.
Oh, I was saying, Ms. Rose, with 35% of Jamaicans reporting the onset of mental health disorders before age 14, talk to us about how important it is to have early intervention. And I also want to know if there are specific preventative programs in place to address issues before they escalate.
So extremely important. We now have a full appreciation, and the statistics tell us, the studies support it, that early intervention in terms of mental health support and wellness goes a long way in preventing the presentation of a mental illness later in life. There is a very robust study that was conducted known as the Adverse Childhood Experiences, and there's a lot of data that supports that children who experience ongoing trauma early in life are at a greater risk for the development of a major mental illness later in life. We know that abuse of all forms has the capacity to rewire the brain in such a way that it makes a child fragile and more at risk for things like learning disorders and disabilities, behavioral challenges, socio-emotive difficulties, and a range and host of other mental health illness. Now, the Ministry of Health and Wellness has a very robust and targeted program in mental health education and promotion. And what we recognize is that we have the privilege of engaging our communities through our schools, or churches, or community groups, or private sector in providing that awareness. Mayor Vernon spoke about us not having a fulsome appreciation of the value and the importance of our mental health. People like to associate, let me say some individuals associate mental health with mental illness. We want to remind that the absence of a mental illness does not mean you're mentally healthy. And a mental illness does not develop overnight. We are very interested in mental illness prevention. So we want to promote and support good mental health practices. And what do I mean by that? Adaptive coping strategies. Teaching our children how to cope with challenges when they face them, because stress is an inevitable part of life. Helping our children to identify what are the mechanisms that they have within them and around them to help them manage their difficulties in a healthy and safe way. And these things are done through the health and family life education curriculum that exists in our schools, health promotion that is undertaken by our nurses and nursing aides throughout our communities, and various groups. You find more churches and private sector organizations will invite mental health specialists to come in and do presentations such as, building effective communication strategies with your children, stress management, self-care. And we really, really, really want to encourage all our partners, private and governmental, to incorporate mental health in the dialogue of their workspaces and a part of their wellness and health programs. The National Health Fund has also been one of our partners that heavily promotes mental health and wellness within all of its health promotion activities. So there are lots of activities that are on the ground. Some of them are more popular or more known and promoted than others, but there is constant engagement at all times.
Have to leave it there. Thank you as always, Georgia Rose, and she is the Senior Clinical Psychologist at the Western Regional Health Authority. And we also have Richard Vernon. He is the Mayor of Montego Bay. Thank you for your time.
Thank Thank you for
Thank you
having
too.
me and wishing you all
And
the
thank you
best.
for broadcasting
Bye-bye.
this.
Wonderful. All the best.